Hello, everyone, and welcome. My name is Bridget McNulty. I'm the co-founder of Sweet Life Diabetes Community, which is South Africa's largest online diabetes community. And I'm also the co-founder of the Diabetes Alliance and SA Diabetes Advocacy here in South Africa. I am so pleased to welcome you here today. We have a terrific lineup of speakers, and it has been a busy week for anyone who cares about NCDs. During this Global Week for Action on NCDs, FIND and their partners have shared views in some fascinating coffee chat videos that I'm sure some of you have seen about all the multiple facets of NCD diagnostics, from the role of diagnostics to help meet NCD targets, to sustainable financing, to the need for a patient-centric approach, and market barriers to innovation in NCD diagnostics, particularly in LMICs. FIND is also officially launching their NCD program today, which we'll hear about later. But what I want to ask before we dive in is, why should you care? Why should anyone care about NCDs? And the stat that stuck out to me the most from this week's chats was one from Bente Mikkelsen from the WHO, who told us this week that 74% of all global deaths every year are due to NCDs. 74% of all global deaths due to NCDs. That is a staggering number. It's a number that everyone everywhere should be caring about. Of course, there's no answer. There's no one magic answer to how to solve NCDs. And I do want to frame today's webinar in that knowledge. We're looking for creative solutions here. Nobody has the answers, but the conversations are critical. Conversations like this that can then be followed by action. So just to give you a broad overview of what to expect today, we're going to start with a question for all of our panelists so you can meet each of our panelists. Then we're going to dig into some more detailed questions related to the coffee chat video discussions from this week, and then open up a debate before wrapping up. We have a lot to get through, and we are only going to take 45 minutes of your time this afternoon. But we do have a chat function open to all panelists, so feel free to introduce yourself, share comments and ideas, any questions that you have that the talks raise. And we're going to have a Twitter chat, which will give you details about a Twitter chat to follow today's webinar. So let me introduce our panelists today. Sergio Carmona is the Chief Medical Officer at FIND. Cara Hansen is from the London School of Hygiene and Tropical Medicine and is the chair of the Lancet Global Health Commission on Financing Primary Healthcare. Sanjay Surin is the Vice President for Access at FIND. James Hazel is from the Access to Medicine Foundation. Beatrice Beta is the Deputy Director of the NCD program at FIND. And Leila Druschik is a nurse living with type 1 diabetes, an advocate and a consultant. We're also joined remotely by FIFA Rahman, who is a civil society representative from the Access to COVID-19 Tools Accelerator, and a principal consultant at Matahari Global Solutions. She wasn't able to join us live today, so she has joined with the video recording for the opening question. So welcome. We are also happy to be with you here today, and we look forward to a robust discussion. Let's take a look at some of the highlights from this week's coffee chat.
And as both of us know, 74% of all global deaths every year is due to NCD. So we have a huge job together to do.
We need to invest to protect our patients. We know that early diagnosis is a cost-effective measure rather than treating those with advanced disease.
So you were mentioning the targets, and if we look at the targets for example, diabetes now, and we also have very clear targets for cervical cancer. But if we use again the example of diabetes, 3 of the 5 adopted targets actually has a need to increase the access to measurement for blood glucoses and HbA1cs. And you know, this is one of the big breakthroughs which again we learned from HIV, is that we now have the community of people living with diabetes as we have for cancer, and also will set up for people with hypertension that guide us, and they are very, very clear. We cannot have access to medicines without self-monitoring, and it has to be at high quality level, and it has to be also with the support of educated healthcare personnel, and also with the focus on health literacy for the patients themselves.
When talking about barriers to access, they can be very different depending on the country or the region in which you're talking about. It could be a pricing issue, it could be a health system issue, it could be a regulatory issue.
If a technology has to be adopted in a public health program, the cost essentially has to be really, really low, so that the programs are then able to offer the technology free of cost.
And I would have to say that access to better diagnostic tools had a big impact on me improving my condition and the quality of my life. If we listen to everyone's voices, I believe in the end we're going to be able to make a successful shift in our community.
So much of what you said should be fed into health systems to improve them and to make them better and more patient-centric. The knowledge of patients is incredibly important to improve policy, to improve delivery of services.
And so this is a great moment to be trying to really influence and persuade governments that they need to spend more on health, they need to spend more on primary health care. And I think what we did in the Lancet Commission was also to show how to spend better on primary health care as well.
We are on the cusp of a new wave of technologies that are designed for these settings for primary health care, where patients can come in with symptoms and they can get their disease diagnosed in a simple test across a range of multiple diseases. We can make enormous progress as long as we can, as you say, build the right coalitions, make sure it's informed by what patients and providers really need, and driven by a local prioritized agenda.
There's all these different flows of money that come from donors and from government and out-of-pocket payments, and I think finding ways that will kind of align resources around a clear set of strategic objectives, I think is really important.
Thank you so much for that. I love how much the patient is at the center of all these conversations. As someone who's been living with type 1 diabetes for the last 14 years, it's only in recent years that that's happened, and it's really exciting. So now I'm going to open up to everyone on the panel. Our first question that we would love to get your thoughts on. Invest to protect is the theme of this year's Global Week for Action on NCDs. Investing in prevention, investing in technology for management and treatment, investing in health system strengthening. In your view, what's the one investment that needs to be prioritized to achieve the global targets for NCDs? Sergio, I'm going to ask you to start us off.
Well, thanks for Bridget. Thank you for convening this together with FIND and many of our distinguished panelists this morning or this afternoon, wherever you're joining us from. I mean, as the CMO of FIND, clearly our priority will be to invest in diagnostics, as Bent and many of you pointed out during the coffee breaks. Without those, really achieving any of the targets for NCDs is impossible, really. And in the context of diabetes, one, as you know, accurate diagnosis as early as possible for those of you that are suffering from this is critical. The longer you wait, the more comorbidities and developed and the higher the cost for the health system to manage those. So for us, investing in the whole ecosystem around making diagnostics available is key. We mustn't forget that these are also chronic diseases, so ensuring that the technology and investments also support continuous monitoring and ensuring that individuals are empowered to take care of their own health is key. In the context of diabetes, that makes a lot of sense, and hopefully for those who we need to screen women, in particular for cervical cancer, again, access to diagnostics for that and investing in it is key. So from my side, they're very clear how the dependency to achieve those targets lie a lot on investing in diagnostics.
So I think it's over to me next. So so I'm going to sort of pick up on Sergio's point. So once we've got the once we've invested in these low cost technologies, which is essential, I think it's really important that we protect patients from the out-of-pocket costs of using those. And again, picking up on this chronic condition, these are lifelong costs in many cases. And we know that NCDs can be as impoverishing over time as the sort of classic, catastrophic, tertiary hospital care. So I would say making sure that once you've got some nice low technologies in place from Sergio's investment, I would say we need to be ensuring that government kind of benefits packages from pooled schemes, whether that's from tax-funded schemes or from social health insurance, include access to both the tests that are needed for regular monitoring, but also for the medicines that are required for managing chronic conditions. Thanks.
Well, hi, good morning. Good afternoon, good evening, everyone. And thanks, Bridget, for the lovely introduction. You really set the context very clear. And, following on from the comments from both Sergio and Cara, I think we all know that as far as NCDs are concerned, they're impacting both the low and middle income countries as well as the high income countries equally badly. And it's I think when you talk about the LMICs, they're kind of faced with a double whammy because they're already saddled with the burden of a high burden of communicable diseases, and the impact of which actually is more pronounced than now when all of us are, beginning to understand the real impact of the COVID-19 pandemic. In fact, the debilitating impact it has had on our health systems, where patients across the spectrum, whether it is communicable or non-communicable, have sort of suffered badly. So there couldn't have been a more opportune theme than, invest to protect. In my view, I think we need to be bold in making our investments. We've already discussed diagnostics. We have discussed, the care packages, as Cara said. I think it is absolutely critical for us to invest in building our health systems, making them resilient and future-proof so that, we are able to face future calamities in a much better way. It's important to build diagnostic capacity, having trained healthcare workers, having technology at the last mile, awareness, affordability, whatever. But I think the most important thing is to put the patient front and center for maximum impact. Thanks.
Great, thank you. I think what you've seen from my fellow panelists and also in the coffee chats thus far is that access to NCD diagnostics is an incredibly complex issue that involves a variety of different stakeholders, from governments to NGOs and funders to the diagnostic companies themselves to patients. And so I think one takeaway for me is really that these funders need to take an integrated and holistic approach that encompasses aspects of the various things we've already talked about: prevention, R&D, health system strengthening, because I think each plays a unique role in overcoming barriers to access. If I had to focus in on one, I would take a moment to zero in on the health system strengthening aspect. I think there's a real opportunity to integrate NCD care into health systems and piggybacking on existing initiatives that have been ongoing and have met great success in the context of infectious diseases, et cetera. So really the take home being, how can we take these, what have traditionally been more vertical streams of funding, and how can we apply them across disease areas in a more horizontal manner that strengthens health systems across the board?
Okay, I just want to sort of build on what's been said about the healthcare system, the ecosystem, as well as the double burden of the infectious diseases and NCDs. And I really think we need to invest in efforts to improve service delivery for NCDs, as this is so often inadequate in many countries. Like, for example, want to think of the integration of NCD screening, diagnosis and treatment in established infectious diseases programs that can be cost effective and also acceptable to patients and healthcare providers. So, and really by doing that and defining different strategies for improving service delivery, it's really very context dependent and critical to understand which sort of service delivery approach works best, right? It is to deliver that was also mentioned patient-centered strategy, strengthen relationships across all stakeholders to get everybody on board and really improve the health system from that aspect for every country.
So I have to add maybe a bit of a different perspective because I'm also a patient and a healthcare worker. So I would say a big investment would be education of patients and education of HCPs, because like even if you have all that access to technology and diagnostic tools, if you don't know how to use them correctly, you're just essentially wasting even more money because those patients are going to have complications and are going to use very expensive technology and not know how to, improve their health. And I would also say like adapting all of those strategies to low and middle income countries because you can't have the same approach. And for example, even like when talking about pricing, you do have to really find a way to make it adaptive for low and middle income countries. Yeah, so that would be maybe my view as a patient. And I think it's really important because from a personal view, I've experienced many issues on that level and saw how so many things fall after that in the wrong way, and it just made my life more difficult. So yeah.
Hi everyone, many apologies for not being able to be with you today. I'm in Bangkok in a hotel room and will be traveling, and so I'm pre-recording this message. The theme of this discussion is invest to protect. And one key sort of urgent investment, which I think needs to happen, is integrated diagnostics for multiple diseases in one place. This would help reduce the time tax and the financial tax for people to access services when they have multiple conditions. And I also think that there need to be community systems which are strong enough to drive demand of those services. And for this to happen, we need community health workers who are already engaged in their systems to be well supported to achieve critical mass for demand on these services.
What I love about all these answers is that each one is different, but they all fit together like a puzzle piece, which brings us back to the reason we're having this discussion, right? It's not that one person has an answer and we all just need to listen to them. It's that we all need to bring different things to the table to move forward. So now I want to ask some more complicated questions, please. Sergio, you spoke about access to diagnostic tools and self-monitoring being crucial for reaching the global targets for NCDs. Could you explain why and tell us what FIND is doing to improve access?
Well, I think Bent and I had a good discussion on this earlier in the week, but for those who missed it, or maybe I should stress as well, after some of my panelists have reminded me of, this is all pointless if we don't also consider a whole system, health system as a whole, the patient, the healthcare worker that also needs to be informed. But let me put it this way, and maybe I should split my answers what it means in diabetes versus another NCD that we care about at FIND, which is cervical cancer. As Bente and others highlighted, 3 out of the 5 global targets directly and indirectly do rely heavily on diagnostics for diabetes, right? So just to remind maybe again, I know it's been a week of all of this, that 80% of people that need to be diagnosed, that's one target, not small number. 80% of those who are diagnosed need to have the tools to control the glycemic index or the glycemia, the level of sugar that they have. And the third is also 100% of those who are living with type 1 diabetes can have access to affordable insulin. And to that, to make it safe, as Leah points out, that you need to have the tools to monitor glucose at hand, and the various available ones. So what are we doing? Well, various things. We do support communities in terms of demand generation, education for the safe use of these tools, and healthcare workers that also need to be kept abreast with new technologies. We invest a lot on making sure that new technologies are fit for purpose for what I've just described in the care cascade of diabetes, and also for associated cardiometabolic issues. And access, I mean, the key part of access is price, and ensuring, as Leah, you pointed out, and that the pricing needs to be adjusted for the countries and the settings that we intend to make these tools available. And the pricing includes for BGMs as well as for point of care, HP, A1C supplies. I would say the investment into the health system is a little bit harder to quantify, pinpoint, but I think many of you have already highlighted the many possibilities of interventions in there. And I just want to spend 1 second a little bit on a different topic, which is cervical cancer. The strategy there is slightly different in that it's a vaccine preventable disease. So diagnostics in isolation of the full strategy is also needs to be considered. For those who did not, for girls or young women that did not have access to the vaccine, the next step is to ensure that they have access to good quality screening diagnostics there. And the molecular tool there it's already available commercially, but again, it's an issue of access and tweaking it so it's fit for purpose and empowering women in that case for self-collection. So again, there's a theme of empowering individuals and communities to take care of their own health. In the case of cervical cancer, what we would like to really highlight is the need for bringing some of those technologies and self-collection into the communities that are at high risk. Have I answered your question?
That thoroughly answered the question, and I love the emphasis on empowering individuals too, because we know that a purely top-down approach doesn't work. So this is kind of the best of both worlds. Thank you. Sanjay and James, you are in the spotlight next. During the coffee chat, you spoke about market barriers to NCD diagnostics being either an access or a technology issue. What can manufacturers do to avoid facing these barriers when they're developing and introducing diagnostics in LMICs? Sanjay, could you start us off?
Yeah, thanks, Bridget. And yeah, I remember this interesting discussion that James and I had, a few days back on, typically, when you talk about disease and you talk about access, it's either an access issue or a technology issue. And basically, sort of indicating when you say it's an access, which means that the technology is there, but it's not accessible to the people who need them. And in the settings that the technology is needed because of various reasons, either it's too expensive, it's too complicated to use, or simply doesn't fit the intended setting of use. And when you talk about a technology issue, it essentially means that the technology is not suited to the environment where we are. For example, if it's a platform-based technology and we're talking about primary healthcare or we're talking about home-based care, it just doesn't make sense. I think if you talk about diabetes, I feel it's more of an access issue. I think the technologies, for example, the blood glucose meter and the strips and the HbA1c meters, they have been there for decades now. But unfortunately, because of issues around pricing and issues around the very important challenge of patient education and which Lila raised, and the education of the healthcare providers in terms of how to make sure that the patients are using these technologies in an appropriate manner, and more importantly, how the results or how the of the test results are being leveraged by the healthcare providers to be able to manage the medication appropriately. So in my view, I think while the manufacturers most of the time they're focused on bringing the right kind of technology and perhaps in some cases also bringing at the right price, it's also important to focus on the education part and building the awareness of the patients to sort of make sure that the technologies get used appropriately and they can get the maximum benefit. But if I were to switch a little bit to, I think Sergio raised a very important point around cervical cancer. I think there it's both an access and a technology issue. Right now, the technologies which are there for HPV testing are molecular, they're expensive. So FIND, for example, is right now working with WHO to look at target product profiles of 4 different target product profiles. And all of these 4 technologies are focused at various ends of the customer or the markets. So to say that while on one hand we are trying to solve the issue of the accessibility in terms of awareness and pricing, on the other hand we're also trying to solve the technology issue. There is a tech landscape which FIND has done, and then there is obviously the investment which is going with the development of TPPs, and then there is a lot of work which is happening with the communities to make sure that they're able to work with women and so that they can come forward and get tested and can have access to appropriate management.
Great, thank you. And James, what's your perspective?
Yeah, so as Sanjay alluded to, I think it's very context specific in terms of the particular disease and particular diagnostic, and whether the barriers are largely access related or whether it is a technology issue. That said, I do think, from a high level, diagnostic manufacturers do have a responsibility to embed access and access planning at every stage in the life cycle of a diagnostic. Starting with conceptualization and research and development, all the way through product delivery. Speaking a little bit more about that, I mean, starting from an R&D standpoint, I think we've seen the focus being on higher income markets. So I think there's a real opportunity for adaptive R&D that can overcome some of these access barriers. Thermostable reagents, point of care diagnostics that are easier to use. Things like that. But I think also companies have a responsibility on the delivery side as well, whether that is seeking out collaborations and opportunities to participate in pooled procurement or supranational procurement mechanisms, all the way to pricing issues that we've been discussing. So tiered pricing approaches that consider either a country or a target population's ability to pay and set the price accordingly in lower income markets. And finally, when those strategies don't bridge all of the gaps, I think there is still a role for companies to engage in things like donation programs and patient assistance programs, particularly in low and middle income countries.
Thank you so much. Gosh, there's so much that goes into it. It's such a complex issue, isn't it? And yeah, it's great to hear the expert perspectives on it. Now I want to turn to a different kind of expert. Leila, could you speak to us from the patient perspective? Even though I know we don't like calling ourselves patients. I always remember someone saying that people with diabetes are not patient, we are impatient for change. What role should people affected by NCDs play in the management of their condition? Why do you think systems need to be more patient-centric?
So I would have to start off with saying that we already take the role of our own caretaker by getting diagnosed with an NCD. So, I play my own pancreas, so 24/7. So I already have that role. Then we also have the role of being an educator to the people around us. On, for example, like if something happens to us, parents have to be an educator for teachers, for so many people around in their community, which means they get a bigger responsibility. You have to be your own advocate to fight for those changes because you just want to live a normal life. So I think by just getting diagnosed with an NCD, no matter it being diabetes or something else, you get so many different roles you have to play in order to be able to function normally, and why the system needs to be more patient-centric. So I would go back to what James also mentioned, like, for example, a manufacturer shouldn't look at us as a customer. We are not a customer. We are someone who has a disease and who needs help in the way of they need to have a more active approach in being more innovative with their solutions on how are they going to implement their products into a market, which means you can't look at us as profit. You have to look at us as something innovative. I don't know how to explain it. I always just get very passionate when talking about it. So I would love to see companies having that more, how do I say, patient-friendly approach in the way of that we actually see that they care about the solutions and that we can get effective care in the end. And I would also have to say, like, without the patient, the system doesn't exist. So the patient also needs to be a part of the decision-making process because you need to hear our voices. We need to be there at the table where all the key stakeholders sit with the politicians, with the health policies managers, with all of the HCPs, and facilitate those meetings to see where we can meet in the middle. Because I think having all of those opinions and professional opinions will really help make everyone happy. So even the manufacturers, even the HCPs, and even the patients, because I feel like there's a lack of facilitation and just everyone is doing what they think is right for the other party. But we lack that communication, especially when we talk about manufacturers and patients. So I think hearing patient voices and just having more, I think, empathy because we are talking about people who are living where chronic condition is really important.
Yeah, 24/7, 365. Thank you so much. And Cara, finally. In the coffee chat, you argue that long-term financing mechanisms for NCDs, diagnostics, monitoring, and care needs to be locally owned. That makes sense to me because they'll be based on national priorities and context. But how can countries put in place these mechanisms? What should the role of the various stakeholders be? Oh, you're on mute. It's impossible to get through a webinar without someone being on mute.
I'm the one today. So I just want to pick up on what Leila was saying, because as you said when you were introducing me, so we recently published a Lancet Global Health Commission on financing primary healthcare, which was very much about sustainable financing for health systems, where PHC is at the heart of health systems, and I think really relevant to the management of NCDs, where locating management, care for NCDs at the primary care level is an enormously useful way to make arrangements more patient-centric, but also more affordable for countries that are struggling with fiscal crises. And one of the arguments that we make is that in the midst of all this discussion about how PHC should be people-centered, we argue that the financing arrangements for PHC should also be people-centered. So they should be I won't go into that because that's all in our report, but through every financing function, putting people at the center is really important for doing sustainable financing. What we asked me was about roles of stakeholders. And we also argue in that report that sustainable and equitable financing for PHC is really an all government thing. It should be really across government. And by that, I mean both across ministries. So the Ministry of Finance is a critical stakeholder here in terms of generating enough resources that and allocating enough to health, but also in setting up the public financial management system in ways that allows resources to flow through health systems in an efficient and effective way. But also, and obviously the Ministry of Health, is a critical partner in doing this, but also thinking about decentralized contexts, in places like India and Nigeria and Kenya, the decisions about what to spend on health are not made centrally. Those are made at the local government level because budgets are held at the local government level. So bringing in, local governments into those decisions about financing arrangements. I think also there's other stakeholders that are important, patient groups as demanders of more and better financing health, but also professional associations as well, in being part of the discussions around health financing arrangements, and particularly around the way that providers are paid for providing care. And finally, development agencies and donors, absolutely critically important. Both needing to reduce fragmentation in health financing systems by avoid creating parallel systems, and thinking, as others on this conversation have said, thinking about joining up and integration, but also being strategic partners for the development of health financing systems, identifying critical bottlenecks and helping governments to relax those critical bottlenecks by investing in whatever is needed, and that and really being responsive to country needs in those investments is critical. Thanks.
Wonderful, thank you. Oh gosh, there are so many smart minds here. We've got about 5 minutes. I would love it if I could invite you all to think on what's the top priority that countries should focus on to improve access to diagnostics and self-management tools for people specifically in LMIC countries. There are lots of priorities to choose from, but if you could just spend maybe a minute saying what your top priority would be. Leila, would you like to start us off?
Gladly. So I would say, as I come from Bosnia and Herzegovina, and I know a lot of people don't even know where the country is. So for example, recognizing the problem, because we don't even have a registry of people living with diabetes, and then you don't even know the impact it's having, the cost it's taking away, the complications, the quality of life. You have no data because you have nothing to start with. And I think by countries recognizing the problems, it would make them invest into that and see it as an investment and not as an expense, because I think we need to change the mindset of the key stakeholders by showing them what the problem is and what the most effective solution for everyone is. So the country is going to spend less money on complications. It's going to have more people that are able to work, people who have a better quality of life. So many things like come together, and I think by just recognizing the problem and changing that mindset of those key stakeholders and decision makers would be somewhere where I would start regarding low and middle income countries, because I see it as a problem as someone living in a low income country.
Absolutely. Thank you. Sanjay?
Yeah, thanks, Bridget. So I think from my perspective, if you look at the stats, perhaps more than 50% of the people who are living in the low and middle income countries are unaware of the diabetic status. And I think that squarely points towards a lack of awareness and, more importantly, education. People think that, I can't get diabetes, and that's why the diagnosis is almost like a shocker. So linked to that is this issue of affordability and access, hence the need to make the technologies, the right kind of technologies, available at places where they're needed and at the right cost. And last but not the least is this entire issue of management and linkage to care. So once the patients get diagnosed, it's also very important that they're able to monitor themselves appropriately and are able to report and are able to get themselves linked to care. And that is where the importance of easy to use digital tools and maybe easy to use diagnostic technologies that can be put in the hands of the patient.
Great, thank you. James, Cara, Sergio, what are your top priorities? Top priority, singular. Cara?
So I'm going to stick with ensuring that that medicines, and I'll expand that to the sort of the key diagnostics are available, because out-of-pocket payments in low-income countries over a PHC in general, out-of-pocket payments are 4 times higher than what governments are spending. And most of that money is being spent on medicines. And so finding really creative ways to ensure that medicines and associated tests and things are included in benefit packages, but then operationalizing those. So what are the different models in which people can get access to those things when they're publicly funded? So really investing in really good models for ensuring that people can access those entitlements if they have it. My top priority.
Thank you.
Bridget, I'll jump here.
FIFA
mentioned something, and I know she would be so part of this conversation. So she mentioned integrating diagnostics into the whole system and seeing a client. I don't know what is the best way to describe. You don't want to be a patient, but it's not a client.
Person with diabetes.
A person with diabetes or a person with potential cervical cancer, is that any opportunity those individuals have access to the health system at whatever level it is, that's an opportunity to screen, to monitor, to provide the tools, right, and integrate them, as many of you have mentioned, within the system, and not create another whole pillar around chronic diseases. Take the opportunity there. And needless to say, the private sector and many others that are involved in innovation can also be part of taking care of individuals that have less access. So integration in service and the whole system as a whole. It's not just individuals, communities too.
Thank you. James, I'm going to give you 30 seconds to throw something in the ring.
So we've talked integration, we've talked health system strengthening. I think I'll end by also echoing something that's been said. I think it's important as countries set priorities that they involve patients, those living with chronic conditions, they give them a voice and a seat at the table, in addition maybe to some of the other stakeholders that are maybe more commonly invited to be a part of that table. So I would just echo again what other panelists have said and really make sure the patient perspective is incorporated.
Thank you so much. And I think this is such a fascinating and valuable conversation. I'm very glad we have a Twitter chat afterwards. Otherwise, I would feel like I was rushing you off far too soon. Beatrice, just in our last couple of minutes, could you tell us a little bit more about FINE's NCD program? It is obviously very timeless if we listen to our panelists today.
Yeah, absolutely. Thanks, Bridget. And I wholeheartedly share what everybody said just now about country priorities. And Cara, what you said just at the comment before we get into the NCD program is really including diagnostics in the benefits packages, because what struck me as so absurd almost is that adequate glucose self-monitoring can be 3 or 4 times more expensive than paying for insulin in some countries, which does not make much sense, right? And obviously, then we know where the priorities lie, if the resources are scarce. So I think that is really one key aspect to get diagnostics, accessible, right, amongst the whole system that needs to be behind it. But so in our program, in the NCD program today, we really recognize that for NCDs, diagnostics play a key role not only at the point of detecting the condition, but throughout the journey of people living with NCDs. They embark on one step. So that really that monitoring aspect and that chronic aspect, and that's why the tools continue to play a key role. So we really prioritize our activities with this in mind, right? For example, addressing the high cost of frequent testing for monitoring of a chronic condition, not only the self-testing, but also the recurrent healthcare visits to the provider to check out status of the condition. But also making sure that the tools are fit for purpose, because many tools, either be it frequently at the healthcare facility or by the person with diabetes themselves, they need to be used regularly, daily, so they need to be fit for purpose, really user-friendly, designed with the user in mind, and also delivered with the right education. That's definitely also one key focus of our program. And furthermore, we look at testing different care delivery, right? And that goes towards the entire patient journey, but also how we can close that diagnostic gap a little bit better. And I think Sergio alluded to it earlier. There's opportunities for people to access healthcare services for other health-related conditions, and where is here the opportunity to actually integrate NCD screening, for example. And I think next up is a short video giving us some examples of the work of our NCD program today and what we've been doing in the last couple of years.
Oh, it's so exciting. Thank you. And thank you so much to all our speakers who have been here today and all of those who joined us during both today and during the week for the NCD coffee chats. We are now moving to Twitter for a Twitter chat. Please join us there. The information is going to be shared in the Zoom chat now, and everyone is welcome to ask further questions or elaborate or share your thoughts. We wanted to keep this short and sweet, and I want to thank everyone for miraculously keeping to their time, but particularly for sharing your insights and your wisdom in this really valuable conversation. Thank you very much, everyone. Enjoy the rest of your day.
Thank you, Bridget.
Thank you so much. Thank you, Bridget. Okay, bye.